While the coronavirus has significantly changed our everyday lives, it also revealed gaps in our healthcare system that need to be filled. One big area of concern for many experts is long-term care homes, which have seen devastating outcomes during the COVID-19 pandemic.
That's really a wake-up call that we need to do much better for people in chronic homes. We would have benefited from earlier intervention to have people who have training in infection control to go in there and say an outbreak is starting.
Banerjee suggests in the event of future outbreaks, long-term care homes could really benefit from a team of experts going in and separating the healthy people from the sick, splitting up all residents who share a room, and do rapid testing to identify residents at risk. Along with changes to patient management, we can also expect to see changes made with how staff are managed. Things like the number of staff assigned to a resident, infection control training, and reassessing whether they should be allowed to work with more than one patient and rotate between homes.
There has been some concern with the fact that care providers may work in more than one home, and so they are potential vectors, if you want to think of it about that, of transmitting the disease from one home to another.
Many countries also face a shortage of personal protective equipment such as masks, gowns, and gloves for their healthcare workers.
Something that's been very stressful to myself and many of my colleagues, well, all of my colleagues, anyone who's doing frontline work, who's being exposed to coronavirus on a regular basis, a lot of them were not feeling protected.
Banerjee says we can't stockpile PPE for the next outbreak because this type of equipment doesn't have a long shelf life. But what we can do is produce PPE locally.
We've really seen that we're quite vulnerable if we're depending on other countries to provide us with masks and other sort of things. So I think you'll see a renewed call for domestic manufacture, domestic supply.
With the pandemic pushing healthcare systems to the limit, experts feel a lack of staffing added to the problem.
It may be that we just really have to think about, do we establish a volunteer corps, can be called on during these times that we really need a lot of boots on the ground.
Jane says this is also an opportunity to create more jobs in the public health sector going forward.
Public health is not the sexy part of medicine, right? It's not where you're being rescued or saved from dying. It's really, if public health is successful, nothing happens. And it's hard to get people to fund nothing happening. But that's really what we want to happen, right? We don't want to have these pandemics.
Many countries also found themselves running low on supply for testing kits, so they had to prioritize who they tested for COVID-19. And because of this shortage, many people had to be turned down for testing and were asked to self-isolate.
We were just totally blindsided and not prepared. I think we have to look at the infrastructure itself. Number one, we didn't have the infrastructure to produce test kits in a timely fashion. We didn't have a good surveillance system. And part of that surveillance system really requires accurate tests. We didn't have that ready.
A shift that's likely to stay will be how we interact with healthcare professionals. Telemedicine was used effectively that helped healthcare workers screen people over the phone for COVID-19, so they could avoid patients from going into clinics and ERs and spreading the virus.
I think we are going to be applying telemedicine to deal with other types of health issues. And I think that's going to make it more efficient.
The COVID-19 pandemic shed light on many deficiencies in our healthcare systems around the world. But experts feel that the negative experiences we faced will be the seeds for positive change in the future. Thanks for watching Global News. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel.